Our next speaker is Dr. Bonnie Goldstein, a pediatrician. Dr. Bonnie has long been an advocate of medical marijuana and legalization, in addition to careful testing of strains for safety, potency, and effectiveness. Let's welcome Dr. Bonnie Goldstein.
Good evening, everybody. It's hard to follow Jose. You brought tears to my eyes, and we all appreciate the service that you gave our country, and what a hero you've become, and what an advocate for cannabis. That's awesome. Everybody always asks me how I got into the cannabis industry, so to speak. And so I was a pediatrician. I trained at Children's Hospital Los Angeles, and I went into pediatric emergency medicine. And I lived that crazy adrenaline lifestyle for about 13, 14 years. And at some point, working until and seeing the sun come up gets old. And at the time, I had a young son, and I took a leave of absence because I needed to get some sleep and regain my sanity. And during that time, I knew someone who was quite ill. And this person was not a cannabis user until she had to be. And when she started using cannabis, she asked me about it, and I'm going to tell everybody here, I didn't know anything other from, I remember college days, but other than that, I knew nothing. I knew nothing about the medical aspects. I had heard about cannabis passing for medical use, but I had no idea that people were actually using it. When I was in the emergency room in the middle of the night, and I worked in East LA, I worked in Kaiser, Los Angeles in the middle of the night. The kids that I saw coming in who were intoxicated came in with number one, can anybody guess? Anybody? Alcohol. Available in everybody's home, available to children. Okay, the number two thing that came in, what was the second thing? Anybody? Pills. Whoever said pills. I took care of tons of kids that came in drunk to the point where we had to put them on a respirator. And I took care of girls that would come in naked, and we had no idea what they were on. They were passed out. We have no idea if they were raped. It was horrendous. And this is with two most legal substances, right? Pills and alcohol in everybody's home. In 15 years, I saw one 15-year-old boy that called 911 because he smoked a little too much cannabis. And he came in, and his heart was racing, and he was having a little anxiety. And we said, you're fine. We checked his vital signs. He was totally fine. We talked him down. We put him in the room. And the worst part of it was I had to call his parents. That was it. There was no ventilator, no intubation, no ICU, no transfer to a trauma center. And so when you look at the dangers, we all know the danger is very, very, very low, even for those who are using it recreationally, right? So anyway, I was asked to talk about the physician's role, and I'm also going to touch on some of the medical aspects, and then there will be a question and answer at the very end for the whole panel. So if you could save your questions, I'd be very happy to answer them. Oh, sorry, Ray, I did it wrong. What do I do? Which one? Sorry. This one? Let me do that. Go ahead. There we go. All right, and so just a quick review how long this has been available in California, 1996. Amazing, it's been 20 years and still most of my medical colleagues are not on board, which I still find fascinating that it's 20 years and doctors still aren't encouraging patients to even try this. But in 1996, California voters passed Prop 215. And Prop 215 did not make cannabis legal. What it did was it allowed doctors to recommend or approve the use of certain conditions. So I can tell a patient, yes, your condition qualifies you and I'm approving you to use medical cannabis. That doesn't make it legal. What it did for those patients was it gave them a medical marijuana defense in court, meaning if you got charged with a marijuana crime or possession, you could say to the judge, hey, I broke the law, but my doctor says it's okay. And that's really what Prop 215 was. So it really did not make it legal, although people think it is legal. Because it's still a federally illegal substance, still controlled in the schedule, which is 1. Schedule 1 is basically no medicinal value, lack of safety, and high abuse. And that is not cannabis. That's alcohol and tobacco, but it's not cannabis. And because it's still a Schedule 1, I am not allowed to write a prescription. So what I give people is what's called an approval letter. And basically this law allows patients to use, possess, and cultivate for personal medical use. You can claim the medical marijuana defense if you were to get in trouble. It also allows patients to designate a caregiver. So if you're sick and you need help with your medicine, you can designate somebody to help you with your medicine. Our law here in California states these conditions: cancer, anorexia, AIDS, chronic pain, spasticity, glaucoma, arthritis, migraine, and the very last one is mine, is why I live in California, and any other illness for which marijuana provides relief. Why should it be listed? What if you are a person who has a rare genetic syndrome and it's not on the list? There are people in other states, and so I grew up in New Jersey. In New Jersey, you know, there's like a handful of conditions, and not only a handful of conditions, you actually have to try and fail every medication for that condition before you can get a letter. And that's cruel and inhumane, if you ask me. The law also allows for minors to be approved with the consent of parents or guardians. Now, in 2002 here in California, Senate Bill 420 was passed. It was not passed by voters, it was passed by our legislature and signed by the governor, and it was enacted in 2004. And there were a lot of questions with Prop 215, and what's very interesting is that, you know, a lot of people say the good news is Prop 215 was vague, but the bad news is Prop 215 is vague. So Senate Bill 420 tried to define what was vague about that to help people understand and to kind of give not only patients but people who are involved in providing medicine but also law enforcement some rules to follow. So remember that this bill did have limitations. You were allowed to have as a patient 6 mature plants, 12 immature plants, and 8 ounces of usable cannabis. And actually, because that was not included in the Prop 215 that we voted on, somebody challenged it and actually it was overturned by our California Supreme Court. So now patients are allowed to have what is medically necessary for the medical condition. And that's a little difficult, still a little gray, but if you're a patient and you have a doctor that says, sure, that's the amount my patient needs, you won't get in trouble for that. This law also further defined caregiver as someone who actually takes care of the patient. You actually have to physically help the patient out. You can't just be a person who delivers medicine as a caregiver. And a lot of people don't realize that in California, the definition of caregiver is different than it is in other states. In Oregon, a caregiver is a person who actually grows your cannabis and helps you with that, and they do not have to take care of you. In California, your caregiver has to be somebody who takes care of you. They pay for your rent, they bring you food, they help you with your other medicines, they take you to the doctor. So here, if you think you're a caregiver because you are supplying somebody with cannabis, be very careful. You're better off forming a nonprofit collective and just being a collective that covers you better. The other thing that Senate Bill 420 allows for is the voluntary state card. Again, it's voluntary, you don't have to do it, but you can go to the state program which is provided in each county, and you can apply for that card, show your letter. There is a fee for it, and then you get that card. And I think I have another slide about that card too. The decision when I see patients in my office, it really does narrow down to this handful of things that people come to my office for. And the decision to use cannabis, for most, I have patients that tell me that they've been going back and forth for 6 months, that they booked an appointment and they canceled it because they had no idea if somebody was going to find out, maybe they would lose their job, they didn't want to be looked at as a cannabis user. And so really the things that drive patients to come get cannabis is ineffective or intolerable side effects of previous treatment. Most of my patients, I did a survey of a huge selection of my patients, 75% of those patients were using other medications prior to coming. You can't say these people just jumped to cannabis, they tried. Many of them tried multiple different medications before they made the decision to try something that actually worked for them. Some patients have to be on certain medications. They're life-saving medications, right? So what if you have side effects from that? You give up something to take that medication that's saving your life. Well, cannabis for many patients counteracts those side effects and allows you to be able to continue to have a good quality of life without suffering the side effects of those life-saving medications. Of course, short-term and long-term side effects, everybody knows, I was talking with some people tonight, when you watch a TV commercial about a drug that comes out, and it's about 10 seconds long of what it does good, and then about 50 seconds about what it does bad. When the medicine's worse than the condition, think twice, okay? And so everybody's shaking their head because they all know, you look at the list of side effects and say, no way, why would I take that? My condition's not deadly, but I can die from the medication. Cost of prescription medications. I mean, this is crazy for some people. I have a patient right now who's spending $12,000 a month on a medication that we were actually able to get him off of by using high-dose CBD. It was for a very severe psoriasis. He really didn't respond to any medications. He happens to be a wealthy guy, and he figured he could do it, but he said, why would I do that if I could get something natural and use something natural that's actually less expensive? And then for many people, it really is word of mouth. They heard from their friend, from their cousin, from their, actually many of my elderly patients hear it from their adult children who say, get off this stuff. They do an intervention for their family member to get off prescriptions and to try cannabis. More and more, and like I said, I've been doing this now about 8 years. Just in the last year to 2 years, I've had more physician referrals than all the years combined, because doctors are finally, after 20 years, getting on board. So we are starting to see that tide turn, and that's a really good thing. In my practice, the most commonly treated conditions, this is the adult list, and you can see there's a lot of conditions on there, and people say, how can cannabis treat so many different conditions? Even an attorney friend of mine says, oh, Bonnie, come on, it doesn't cure everything. It doesn't cure everything, but boy, it cures a heck of a lot of stuff, or it treats a heck of a lot of stuff. So chronic pain for sure is the #1 thing that I see. And you know, people have pain for many different things: nerve pain, arthritis, migraines, post-traumatic pain, multiple sclerosis causes pain. Sleep disturbance is huge. When I have patients that come in, so many of them say, well, if I could just sleep, I could deal during the day. If I could just get a good night's sleep. And you know that cannabis helps people sleep very well. GI illness, irritable bowel, Crohn's disease, ulcerative colitis, acid reflux, psychiatric disease, so anxiety, depression, PTSD, bipolar. You already heard some people talking about that tonight. And then a whole slew of conditions, cancer, HIV, glaucoma, phantom limb pain, autoimmune disease, and then of course epilepsy. In children, by far in my practice, the #1 is treatment-resistant epilepsy. Everybody here may not know this. Only 60% of people who take anti-epileptic medications actually respond to them. That leaves a good 40% that don't respond. These people are living with life-threatening seizures. They have to have another option. The studies clearly show that only about 47% of patients respond to the first medication. After that, if you don't respond to that, 13% chance of responding to the second medication. After that, 1% or less chance to respond to the third medicine. I have patients coming in who have tried 25 different anti-epileptics. Why isn't cannabis somewhere in the top 2 or 3, right? In children also, I take care of a lot of cancer patients. Also, I see a lot of patients with autism. And I do see a fair amount of mostly teenagers that will come in with some psychiatric disease, Tourette syndrome, bipolar, severe anxiety, depression, a condition called PANDAS, which is if you get a strep infection. For some patients, it flips on the autoimmune system, and basically you attack your own brain, and they get tics and psychiatric disease from having a strep infection. It's rare, but it can happen, and cannabis works beautifully to help those patients. ADHD, which, you know, I have to just share with you. Recently in my office, somebody said to me, you know, there's like 2 young men in your office. They don't look sick. And I said, well, you're not walking around with your diagnosis tattooed on your forehead, so why do you judge those guys? Well, I see a lot of young people going in and out of the dispensaries. How many people here know somebody with ADD or ADHD, right? A show of hands. I mean, it's all over. And, you know, doctors are diagnosing it like crazy and prescribing. If you read any of the information out now, it really is to sell a lot of drugs. But many of the people who have it find that cannabis helps. And so why take a stimulant if you can take something natural? And then also terminal diseases, including devastating genetic disorders and advanced cancers, where it's really about quality of life and compassionate care. And these children should not suffer. Sometimes, you know, I joke around that I became a pediatrician because it was easy to tell if a kid was sick. If you can't catch them when they're running around the room, they're not that sick. If they're laying in the bed and let you do whatever to them, they don't feel good. It's easy. You know, there's a lot of children you'll see, you know, you see a child in a wheelchair, you see a child who's suffering. Why shouldn't they have quality of life? You know, I recently had a patient come in with leukemia. And the kid actually has a pretty good chance of doing well. They've given the family over 90% chance of surviving their leukemia with the current treatment. But this particular child does not do well with chemotherapy. The child stays up all night crying in pain. If it was a 45-year-old, they would give them medication. The doctor basically told the family, we can give Tylenol, but that's it. So we're going to let a child suffer all night rather than give a small dose of cannabis so that they can sleep and have some quality of life. So I just find that sometimes with children, people overlook because, you know, we never assume that they're going to feel the same way we do, but they do. And they can have, and it's just compassionate to care for children that way. Now, Ray touched on this. The big thing here is the endocannabinoid system. So nobody knew about the endocannabinoid system until about 1990. That's not that long ago. All right, I was actually already finished medical school, so I didn't learn about it in medical school. And what the endocannabinoid system is a system within your brain and your body that actually, its job, its function is to maintain balance, to maintain what we call homeostasis. So the way I like to describe it is you're floating along on your boat, and every now and then a wave comes along, and it's either injury, inflammation, something like that, and your boat tips. And your endocannabinoid system is supposed to kick in and get you back into balance. Okay? How does it do that? Well, you make a cannabis-like compound, and Ray showed a nice slide that showed the molecule. THC looks very, very much, almost identical to a compound that we all make every day in our brains. That is why no one dies from cannabis. We don't have a place in our brain where you can overstimulate and die. Your body knows what to do with cannabis. When we talk about virtually no side effects, sure, like this young man that came into the ER in the middle of the night who had smoked too much and had an anxiety attack, but there was no chance of him having a fatal reaction. You can go over and tip over a little bit in the other direction, but for the most part, it's extraordinarily safe, and there's a multitude of studies. And for those people who say there's not enough studies, I say go to Google Scholar and type in cannabinoid. You'll have reading from now until the day you die. There's plenty of studies to show that it's very, very, very safe. And so one of the reasons is because your body's used to it. You make it. It's already there. Now, when there's imbalance in that system, okay, illness results. So for instance, they found that some patients or some people who do not make their natural, what we call endocannabinoids, their inner cannabis, actually can have epilepsy. We also know there's a classic triad of conditions that we know that they're calling clinical endocannabinoid deficiency: migraines, fibromyalgia, irritable bowel. Okay? And Dr. Ethan Russo is a neurologist out of Seattle who's incredible. He writes so many articles. And he says that, you know, women have migraines, fibromyalgia, and irritable bowel, and a male doctor says to them, oh, it's just in your head. Well, it is in your head. It's your endocannabinoid system that's not working. Now, sometimes you can get an illness, and the illness actually tips you over. So it's not that you have it and you don't feel well. It's that something happened to you and you tip over. So it can be the cause or it can be the effect. And that's why so many people find cannabis helps. If you're born with something, I have patients who tell me that they have lifelong insomnia, anxiety, ADHD. From the moment, their first memory, they remember being that person, right? They were likely born with an endocannabinoid deficiency. I have women that come in and say after pregnancy that they're just off, and everybody's saying, oh, it's your hormones, and they get put on all these hormones, and they just don't get better, and they use cannabis and they find they're better. Well, somehow pregnancy may have tipped over their endocannabinoid system. What's interesting is that most of us, very common in America, chronic stress, poor diet, sleep deprivation, all seem to cause endocannabinoid imbalance. So it's very important that you manage your stress levels, that you try to get some sleep, and that you try to eat 90% of the time healthy. You're allowed to cheat 10%, but you should try to take care of it. Part of that is all good health, but part of it is keeping your endocannabinoid system in balance. The endocannabinoid system is just about everywhere. If you look at where the system is mapped out, it's brain, it's gut, and immune system. Those are the three big places, and then it is in multiple other places: heart, liver, lungs, so on and so forth. Now, like I said, by using cannabis, you're overriding your inner cannabis and you're feeding the endocannabinoid system to go back into balance. I like to use the analogy of thyroid hormone. So everybody knows somebody who has low thyroid and gets prescribed what? Thyroid hormone. It's supposed to get you back into balance. If you have an imbalance in your endocannabinoid system, what should be your treatment? Cannabis, right? At least you should try it. But if you don't get diagnosed with an endocannabinoid deficiency or a problem in your endocannabinoid system, you're not going to get the right medicine. You get a slew of other medicines. But also I think doctors are reluctant to acknowledge the system because the medication that's the answer is still a Schedule I drug. And there's still a risk to doctors who might be doing this the wrong way to get in trouble and to lose their livelihood. So we really have to change the whole focus of this, that everything we've learned about cannabis, we have to unthink, we have to educate everybody you come across. You need to tell them. If they say cannabis is bad, say, what's the endocannabinoid system? What's a cannabinoid? And if they don't know the answer, they shouldn't have an opinion. I joke around, my husband's here tonight, and I joke around, I have no opinion about a car, because I have no idea how a car works. Okay? He's got lots of opinions. Okay? If you don't know, you need to, but at the same time, we have to undo the brainwashing that's been done, right? Because the system is very complex, and it's fascinating, there have been over 3,000 articles written just this year so far in the scientific literature. It's probably more than that by now. I think in early May, it was about 3,000 published cannabinoid articles just in a period of 4 months. It's a very complex system. Scientists are still trying to figure it out, and there's a huge amount of research going on in Israel, in Great Britain, in Italy. Doctors in the United States are still really being restricted from doing significant research, and that's why the federal status has to change. But the system is so complex. One size does not fit all. I have a lot of people that approach me that want to design cannabis products, and I won't call out, there's a recent one that's been in the news that's been designed for women, and for women's problems. It's the same cannabis that everybody else has. They're just slapping a different label on it. Basically, patients have to find what works for them. You get educated, know what the products are, and you kind of have to select through, and it is a trial and error. If you're lucky, you pick, the first time out. I do have patients that say, my friend gave me a candy bar. He felt sorry for me that I wasn't sleeping, and I took a little piece, and I slept all night, and that's the only thing I want to use. It worked great for me. That's pretty lucky. For some people, they have to search around different strains, different potencies, different products, different CBD to THC ratios to find what works. And this is why I say you have to have a lot of products available. We can't just have 1 or 2 products. There's room for everybody because there's so many people out there who need different things. Dr. Abrams, who is a hematologist, oncologist, who studies integrative medicine at UCSF, and he's been a leader because he does a lot of studies on cannabinoid therapy, and actually is doing inpatient studies at UCSF using cannabis that's being distributed in the hospital for patients right now with sickle cell anemia pain. He came up with this terminology, patient-determined self-titrating. And what that means is the patient knows their dose. They know when they feel good. They know when I took too much. I'm not going to do that again. Let me back up on the dose. Self-titrating means they will get to the dose that works, and they very, very rarely go over that because it doesn't feel good. I joke around in my practice that, and all of these people in here who've overdosed on cannabis edibles or something will be shaking their heads. So many people will go get drunk and puke and feel terrible the next day and then do it again a few times in your life. But boy, you overdose once on cannabis, you don't go back, right? So part of that is because it really is very psychological and can be very trippy. But most patients, remember, patients already have a big boulder in their path in life, their medical condition or conditions. They want to get around that boulder. They are not interested in adding cannabis dependency on top of that boulder. So that's why I always say, you know, I'm never going to be able to stop people from overdoing cannabis. There's always going to be that portion of our society, and that's fine, because I know they're not going to die and become a statistic. But at the same time, we have to remember that patients are going to find what works well for them. They will come in and they will tell me, this works for me. And just a quick story I'll tell you, I had a lovely woman who came to see me. She was horribly depressed and anxious. Her daughter had died in a car accident, and she was taking care of her grandson, and she was trying so hard to keep it together for him. And cannabis helped her. She said it helped her sleep at night so she could keep her act together. She could get up in the morning and function. Sometimes she did medicate during the day because she was so overwhelmed with grief that she couldn't get out of bed. And one year she came into the office and she said to me, I found it. I said, well, what did you find? She said, I found the strain that works for me. She said, but I hate the name. I said, well, why? What's the name? Well, you know, cannabis, many of the plants have different names, right? Well, this particular one was called Trainwreck. And she said, I'm not a train wreck on it. I'm great on it. I said, well, change the name to like, you know, Susie's Salvation or whatever you want to call it. You could change it to whatever you want. It doesn't matter. But that particular strain was her solution. And that's why it's so important to have so many different products available so that patients can try different things. All right, so the role of the physician, you know, the medical board does give me the right to practice medicine in the state of California, and in return I basically say that do no harm and that I'm going to follow what's called standard of care. So the standard of care for a medical cannabis physician is a detailed history of the illness and of what's going on with the patient. It includes a physical exam, a review of medical records and previous treatments. You can see what patients have tried, and remember, in California, patients do not have to try and fail any medications in order to get medical cannabis, which is huge. And I applaud California legislators or whoever, you know, initially wrote the medical cannabis law for doing that. You have to have informed consent. So believe it or not, in my practice, I have all these awful things that the medical board makes me tell patients about cannabis that they have to sign off on. And then I'm required to maintain proper documentation and medical records. And if I don't do any of these things, I can actually be cited and I could lose my license if I did it multiple times. As a physician, there's two questions I always have to answer to see if somebody is going to get cannabis. Does this patient qualify based on the law? And then the second question is, based on my medical opinion, will this patient benefit from the use of medical cannabis? And in my practice, we have a little, like, kind of pre-screen patients, so I know usually by the time somebody comes in that they will qualify because we do pre-screen them. But I've had patients come in who have very rare conditions, and the reality is I don't know for sure that they may qualify. Remember, any other condition I'm allowed to say, but sometimes I don't know because I haven't seen anybody like that before, or there's no research on that particular condition. Once a patient's approved, they're given a letter of recommendation. It's usually a 1-year approval. Now, the 1 year is not something in the law. That's the medical board telling me I have to see patients every year. So some patients say, oh, this is just a way to make money, and it's like, I couldn't give you a prescription for Vicodin for 10 years and just send you on your merry way with, you know, 90 refills. I'm not allowed to do that. So pretty much it's a yearly check-in. The letter has two functions. The two functions really is to show law enforcement that you've been approved, and then the second function is to be able to obtain your medication. All the collectives in my area require you to bring your letter each and every time, and I always tell patients, you want your letter when you leave, because if you have medicine in your car, that's the most likely place where most people get in trouble. If you get pulled over for something, you want to have your letter to be able to show law enforcement. Now, going back to the Senate Bill 420, remember I said it established a voluntary state ID. The program is called MMIP, the Medical Marijuana ID card program. You go to the County Department of Health, and for a fee, they will give you basically take your paperwork from you, a form you fill out plus your letter, and then they fax over to the doctor who saw you, and they ask, did you actually see this patient? So what they're doing is basically circumventing you and just making sure that that doctor actually exists, that it's not a fake. And then once they verify the physician is valid through the medical board, and you get that card. The card gives you immunity from arrest and prosecution. In the 8 years I've been doing this, I've had probably 8 subpoenas. Only one out of those patients actually had the ID card. Everybody else did not have it and was dealing with quantity. So I'm not an attorney, I'm not supposed to advise anybody, but if you deal with quantity, you should have this card. It really does protect you. The guy who got in trouble because he had a probation for some previous problem, and he wasn't allowed to have any guns, and he had guns in his house. So actually all the cannabis charges got dropped. It was really for something else that he got in trouble for. The other thing is that if you designate a caregiver is allowed to get a document that says they are a caregiver, so that if they need to go pick up medicine for the sick patient, they can go to the collective and they can drive that medicine over to the patient. I see a lot of pediatric patients whose parents are paramedics, firefighters, law enforcement, licensed attorney, something like that, and everybody gets nervous. Oh, I don't want my name on anything. In the law, you're actually protected as a caregiver. You're not the patient. You're not using the medicine. You're just assisting somebody in your family, usually, who needs help with the medication. So you are protected actually legally, and you are allowed to have that. However, if you, let's say, had a drug test at work, your caregiver letter would not protect you from being, if you tested positive at work. Here's a list of what medical doctors are not allowed to do. I'm not allowed to approve somebody who doesn't qualify. Same way I wouldn't be allowed to write a prescription for a drug that the person didn't need. I'm not allowed to work for a lay person. So all medical practices where someone is writing a letter for medical cannabis, where a doctor is actually writing the letter, it has to be at least owned by 51% or more by a physician. There's something called the corporate practice of medicine. Other states may be different, but in the state of California, the corporate practice of medicine is forbidden. The whole idea behind that is that there are doctors that were working for lay people, and they said, just give everybody a letter, get them through, take their money. A physician is kind of held to a higher standard. You're supposed to do what's in the best interest of the patient. I know that's not always what happens, but that's what's supposed to happen. So if you go to a doctor to get a letter, you should, before you even go there, you should call and make sure that a physician owns the practice, because basically it invalidates your letter if somebody gives that to you and it's not a valid letter. I know of young doctors who went to moonlight in practices and basically now have forever on their license aiding and abetting the unlicensed practice of medicine. And good luck getting another job if you have that on your public record. I'm not allowed to sell or dispense cannabis products or own a dispensary. I guess that, again, conflict of interest, although I'm allowed to get pharmaceutical samples and hand them out, but I'm not allowed to do that with cannabis. I'm not allowed to refer patients to one specific dispensary. So what a lot of patients ask me is, where do I go? I don't know where to go. So I refer patients to websites that have basically lists of, you could put in your zip code and you can find dispensaries, you can read reviews, you can see what the menus are. They call those finder sites, right? There's Weed Maps, Pot Locator, all kinds of different ones. And so patients basically go to those. And then also, I'm sure you've all heard of Skype visits. The first visit is required by the medical board still. They may change this, but it's required by the medical board to be in person. And then again, minimum once a year visits should be conducted. Why see a medical cannabis specialist? Right now, there's so many doctors that are still not interested in even talking to you about it. They don't know about it. You probably know more just tonight listening here than most medical doctors. Most medical doctors don't even know about endocannabinoid systems, so you're way ahead of most. Basically, the science of the cannabinoid system and how it's used in medicine is still not taught in medical school. That's one of my 5 to 10-year goals, is to get it on the curriculum, at least a day's worth, because that's what we get for nutrition, so at least we could get this in too. Most primary physicians and specialists are still fearful of losing their medical licenses. And even though we've had it here for 20 years, there's still doctors that are very fearful. And part of that's because when it very first passed in '96, they arrested doctors. Law enforcement and medical board went after doctors. And, you know, it's your livelihood. You're very careful about what you're doing. And unfortunately, many doctors really don't even want to step into that. Most physicians don't understand now the multitude of products available. So it used to be that, you know, you could just take a puff off a joint and you feel fine, right? Now when you go into a dispensary, there's like thousands of products and you're like, what is that? How do I take that? What's in it? So it's become a little complex for patients. So in my practice, I actually have like wrappers and pictures and all kinds of things to show patients, say, you know, these are edibles, this is how you read an edible label. This is a tincture, this is how you read that. This is a vaporizer, this is how this works. So it's really an educational thing. I don't tell patients what to get, I just educate them on that. And so what I started doing with some doctors is teaching them, you know, go into a dispensary, get a few products, right? And so that you can show patients what's available. And then the big thing too, not only follow up medically, but also legally. You know, if I got called into court for a patient, I would stand up for them because I vetted them. And if they have a letter from me, I know that unless they're doing something really egregious, that I can back them up. And then follow up treatment. So all of the pediatric patients, you cannot give a letter to a child and say, here, you know, go treat your epilepsy and not follow up with that child. These kids have very severe illness. And the parents need to be able to check in with you and see you. So you really have become part of the team of specialists that usually follow these very sick children. And then really what we've been talking about tonight, education and knowledge. I mean, that's basically the key, right? The brainwashing, the only way to undo it is with education and knowledge. So arm yourself, go to websites, read, understand, be able to explain, even like I call it the elevator pitch in 5 minutes, why cannabis is a medicine, right? Stop viewing cannabis as a drug of abuse. I have a parent, he's actually a doctor, his daughter's very, very, very ill, and he's so worried about her taking too much. And I'm like, she's been on 35 different psychiatric medications. She can't overdose on this. Nothing else has helped, and the thing is, it's helping her. And he keeps telling me, I can't undo the brainwashing. It's so hard because doctors in medical school are taught this is a drug of abuse. We're all taught, don't do drugs, don't do drugs. Children and teenagers. So what should we tell our children and teenagers? And this is something that really frustrates me. I am the mom of a 15-year-old boy. He's very curious about what he calls weed, okay? Everybody's talking about it at school. Some kids are doing it. Guess what? When I was in high school, everybody was doing it too. It hasn't changed. Our drug war has not changed anything. So what we do is we educate. So people say, well, what do you teach your child? Very important. A normal functioning endocannabinoid system is crucial to a teenage brain becoming an adult brain. It needs to function uninterrupted. If you are sick and have an endocannabinoid illness, right, it's okay to give cannabis. But to a healthy, normal, functioning teenager, by disrupting that, you can disrupt the end result. It won't even be that bad, but at the same time, that's what we should be telling people. I started this conversation with my son when he was 8. He's now 15. And you know what he says to me? I'm curious, Mom, but I'm going to wait. I'm going to wait till my brain's developed. I also tell people, ask your child, you think I should have done drugs when I was pregnant with you? Should I have drank alcohol, smoked cigarettes? Should I have done anything while I was pregnant? Well, no. Mom, why would you do that? Well, because your developing baby relies on the mom not taking all kinds of things so that baby can develop normally. The brain in a fetus, the brain in a teenager, the two most vulnerable times for the brain to be growing and changing. So if we could just educate our kids that if they can just wait, this whole nonsense, just say no, does not work. When you say no, they turn around and run towards it. So what we have to do is change that whole dialogue, right? So very, very important. All right, and here's why I do what I do. This is a handful of my patients. The little boy in the top left corner, his mom is holding him. That boy was having over 100 seizures a day, every day of his life. He's in the little red t-shirt in the top left there. He has 1 seizure every 2 weeks. Okay, the little boy, a little girl with cute little purple eyeglasses. This is a little girl who was adopted by the most loving family. They knew the woman who was giving her up for adoption planned on giving her baby to them, and she had a stroke in utero. So when she came out, she had all kinds of problems. And her story is that no medications worked for her. She was having 40 to 50, maybe even 60 seizures a day, and it was really interfering with her development. And this family, you know, I told them, text me every 2 weeks, because every 2 weeks we'll go up on the dosing, start low and go up. That died like clockwork. It was like 10 o'clock Friday I got the text. I'm pretty sure it was in the dad's phone. We have to tell her. So we went up. And 1 week, he texted me and he said, I think it's working. On Monday, she had 40 seizures. On Tuesday, she had 23. On Wednesday, she had 14 seizures. Yesterday, she had 6. And so far today, nothing. It was that apparent to them. This little girl, we're on kind of a half selfie there. This little girl here came to me, 9 years old, terrible seizure disorder, on a drug called Keppra. If anybody knows Keppra, it's a horrendous drug. Causes rage and can make a child extraordinarily hyper. She didn't really speak very much, and she couldn't read or write, and her last visit she read me a book and she wrote her name in cursive. Basically all medicine, I think she's on the tail end of one. And then my young friend in the crazy top hat with the zombie coming out of his stomach, that's a boy named AJ, and AJ came to me with 90 days to live. He had metastatic bone cancer after 2.5 years of chemotherapy, and he was dying. He'd had 17 surgeries and every chemotherapy known to kill that kind of cancer, and they were losing the battle. And he started cannabis oil in April of 2015. And the parent, the dad basically picked him up out of the wheelchair and laid him on the examination bed. He was so weak he couldn't even walk. We started him on high dose cannabis oil, both CBD and THC. And when I told the parents, we might be able to get somewhere, let's just try. But really it was a quality of life for them, but they didn't even know you could use it to treat cancer. So within the first week of treatment, he was off opiates and had gained 8 pounds. Which was huge quality of life, and was sleeping. And April 2015 to July 2015, in 3 months, he had 4 scans in July that were all negative for cancer. Gone. What's fascinating about him is that his oncologist sent him to me, a pediatric oncologist at Kaiser, sent him to me. This is because she was reading about it and knows about it. I don't say that it's a cure. By the way, he's still cancer-free. It is now a year later. Okay, still on cannabis oil. He was on chemotherapy at the time that he was failing. They called it a palliative dose, meaning a very low dose, just because nobody wants to take chemo away from a child who, it's very hard to stop treatment and send somebody home to die, especially when they're 16. But what's interesting is there's studies that show that that particular chemo and cannabinoids, when mixed together, work better. It helps the chemo work. So I do believe that it's not just cannabis, but it may have been the combination in this patient. And I think it's very sad that we had to wait till the very he was in that kind of state, all right? So there's a huge amount of potential with cannabis. I don't call it a cure necessarily. We'll have to wait and see with him, but certainly extension of life. His parents got Halloween, Thanksgiving, Christmas, and another birthday, and I think that's huge. At the end, I'll take questions. I appreciate everybody listening, and thanks so much.